Perfect. This is exciting. Just breathe. Oh, is this supposed to be quiet for this one? Just
Alrighty. So imagine you are sitting in a dental chair at a dental office. Have you ever considered the technology that is around you and the new technology that is advancing? And have you ever considered getting your mouth power washed at the dentist as well? Although this idea may seem absurd, new air polisher technology is making this absurd idea a reality. My name is Natalie and I am a second-year dental hygiene student at the University of Cincinnati, and I see multiple patients every single week, and I have treated them with this new air polisher technology. A lot of them are unfamiliar with air polisher technology. However, after being treated with it, they have learned to love it and are amazed at the results. This air polisher is breaking into mainstream dentistry around the globe, into public schools, and also into private practices. However, a lot of the patients are unaware of the new technology available to them. You are also able to utilize air polishers on complex patients, and they love the results. We are going to discuss air polisher technology first by defining the characteristics of an air polisher, the cleaning mechanism, some advantages afterwards, and then finally we're going to wrap up with some disadvantages and some medical contraindications. First, how does an air polisher work? What are the basic mechanisms and how does it clean? Polishing is the final step in a dental cleaning. It starts by removing any excess bacteria, biofilm, plaque, and any other debris off of the tooth surface. It uses a combination of air, powder, and pressurized water, and it shoots from a handpiece that is connected to the dental unit. It is activated by a foot pedal on the floor that the hygienist will step on, and then the powder will shoot from the tip and clean the tooth surface. The hygienist will also use a high-speed evacuation in order to suction any extra water, powder, and patient saliva during the procedure. And it can also get very messy, so we like to provide our patients with paper towels. The mechanism of action of an air polisher is the particular powder particles that come out of the handpiece. They are abrasives that will abrade the tooth surface and rub off any debris, including bacteria, light calculus, and also any bacteria. It is good for hard to reach places, in the deep crevices, and also areas where hygienists have hard times instrumenting in between. There are different powders with different purposes that are good for different sorts of patients, including healthy patients with healthy gums, patients with sensitivity, and also patients with periodontal disease and deep pockets. Now that we have discussed the basic mechanisms of an air polisher, next we're going to be going over some advantages and why it's hitting mainstream dentistry. First, the polishing machine is looking to replace the traditional rubber cup polisher that is a standard in most dental offices today. While the rubber cup is efficient, it is oftentimes tricky to clean in between deep pits, fissures, and grooves in teeth, and is also tiring on dental hygienists after patient. According to the Journal of Dental Hygiene, the air polisher is effective with cleaning pits, fissures, and grooves, especially within the back molars. It is efficient in stain removal after coffee, tea, and tobacco staining. It requires less time in polishing procedures, and it also has less hygienist fatigue after time. Also, according to the Journal of Dental Hygiene, it is effective on a variety of different patients, including healthy patients and those periodontally involved, as I mentioned before. All of these sound like promising characteristics, so why aren't all dental offices investing in this type of technology? While there are some medical contraindications in certain demographics, we like to consider these before treating a patient. According to ColgateProfessional.com, patients suffering from hypertension and sodium-restricted diets should avoid using an air polisher due to the content of the powder that may interfere with these conditions. Other patients with communicable, respiratory, and infectious diseases should also stay away from air polisher technology due to the production of aerosols that may spread from hygienist and to patient. Other disadvantages, according to a TPC operation manual, include possible gingival trauma due to improper instrumentation or hygienist error. It can also be messy and splatter all over the patient's face. It is expensive to invest in, and it may be hard to maintain due to clogging of the handpiece due to improper drying. In conclusion, air polisher technology is advancing and something to look forward to, and is reaching thousands of patients across the globe. There are many advantages, including efficient biofilm removal and time efficacy. Although it has many disadvantages due to medical complications and technical difficulties, it is still advancing and something to look forward to at your next cleaning. So next time you visit the dentist, consider the technology around you and ask the dentist if you qualify for dental power washing.